Yes, sir. Hello? Yeah. There's some people here. Yeah. Okay. Yeah. No problem. All right. Bye. All right. We'll go ahead and start. Raymond Garcia, your instructor. I have been a technician, I guess, 20 years. I guess now. Started instructing last year when COVID hit. It's been kind of crazy since then. But I can tell you that the push for pharmacy techs, COVID has really posed the need for pharmacy technicians. Um, we're going to go over the stuff that PTCB has outlined for us. Let me see if I can find that. Turn this on. I've been teching for 20 years. I've done retail, hospital, compounding. I have not done mail order or anything, but here that's pretty self sufficient. Um, you can find those usually like San Antonio, Dallas area. Um, I think the what I liked the most was compounding because I mean you're creating medication for people with special needs, uh, people who have trouble swallowing, who have trouble like maybe babies that don't like certain types of flavors and stuff. So what flavor? They have a different flavor for a medication. We even compounded stuff for dogs, different animals. Um, I worked in the hospital for like almost 10 years. I did a lot of IV work there. Um, I can tell you, working in the hospital is a whole lot better than retail, mainly because you don't have to deal with patients, them yelling at you, whatever. You're gonna have to give. I mean, dealing with patients is always the hardest thing because they have sometimes they have attitude towards you and you didn't do nothing wrong. You still got to be nice to them and everything else. But working in the hospital, you'll deal with the nurses and whatnot, but it's not as bad. You may start off in retail once you get certified. Probably the fastest way for you to get in the hospital is to get some experience in retail and then jump into hospital. Some hospitals might jump uh, if they're in great need. They might hire a inexperienced tech, but for the most part, they want a technician who's got maybe a year under their belt and whatnot. But I mean, I've enjoyed it. It's paid the bills. I managed to uh, find a job anywhere that I moved to. I've lived in San Angelo, Evelyn. I'm from La Mesa. Uh, Worked here for the longest, 10 years at the hospital here, and then I jumped to bigger, better pay over there in Big Spring. I worked over there as well. So I mean, it it's you can find a job. It's just a matter of if who's hiring and what they're looking for, and if they are being picky of your experience or not. Let me go into here. This is Indeed. It's got different of well, I'm sure y'all looked at this, but it's got a whole lot of different ways or genres as to what different jobs that pharmacy techs can get into. like I said, compounding. And also the new thing now is for us to do immunizations with COVID being at the forefront. We are doing immunizations now. And I was looking down here and see this one right here, pharmacy technician for COVID-19 vaccination, starting off at $35 an hour. I mean, that's pretty good. I mean, really compared to a lot of jobs that you graduate with degrees and stuff like that. I mean, that's almost comparable to almost a nurse's pay right there. Nurses are all, well, registered nurse would be about 50 in that 50 an hour or so. But there's a whole lot of different opportunities when you become a certified technician. And with PTCB, you can get certified, and you're certified nationally, so you're able to work anywhere in the United States. I mean, once I get done here and want to move around, I plan to go around Florida, Hawaii. I plan to travel around. So, I mean, that's what it allows for you to do as well if you want to travel. So that's in my future, is to start traveling as a pharmacy tech and seeing where it takes me. I just want to see different scenery for the most part, but it has its perks. Other than having to deal with certain people that are disrespecting you and whatnot, but you can blow that off and enjoy your job, pays the bills, and I mean, I like it. I have not thought about getting into anything different, but for the most part, it's paid the bills and it's helped me out quite a bit. So once you get certified, hopefully find you something that you like. This is ptcb.org, and I'm sure you've seen this outline here as to what the exam is covering. Hello. Your name? Whisper. And yours? What is it? Okay. I'm gonna pass this around. You can sign it. By your name, please. So the test is composed of 40% medications. That's what we're going to start off with today. That's probably the most extensive part of the test. Gotta know your generic names, your brand names, classifications of medications. Therapeutic equivalents. That's what the medication is compared to other medications. See what we can use. A lot of times hospitals will do this for financial purposes. Common and life-threatening drug interactions and contraindications, we'll talk about that. Your drug disease, your drug dietary supplements, drug laboratory, drug nutrients. Strength dose and your dosage forms, routes of administration. Special handling and administration instructions and duration of drug therapy. You got common and severe medication side effects, adverse effects, and allergies. Indications of medications and dietary supplements. Drug stability, oral suspensions, your insulins, your constitutables, and injectables and vaccinations. Yeah. Oh, no worries. Just sign your name and then find your seat. Your narrow therapeutic index, your NTI medications, physical and chemical incompatibilities related to non-sterile compounding and reconstitution, and proper storage of medications, temperature ranges. Yeah, thank you. The test is 12.5% federal requirement. Federal requirements for handling and disposal of non-hazardous, hazardous pharmaceutical substance and waste. Federal requirements for controlled substances, prescriptions, new refill transfers, DEA controlled substances and schedules, and federal requirements for controlled substances on how we receive it, the storage, ordering, labeling, dispensing, reverse distribution, take back programs, and loss of theft. Federal requirements for restricted drug programs and related medication process, pseudoephedrine, risk evaluation mitigation strategies, and FDA recall requirements on your medications, your devices, supplies, supplements, and classifications. And you also got patient safety and quality assurance. I got you. All right. Also, issues that require pharmacist intervention, drug utilization review, DUR, adverse drug events, OTC recommendations, therapeutic substitution, misuse, adherence, post-immunization, follow-ups, allergies, drug interactions, event reporting procedures, your medication errors, adverse effects, and product integrity, meta watch, near miss, root causes and analysis, types of prescription errors, abnormal doses, early refills, incorrect quantities, incorrect patient, incorrect drugs, hygiene and cleaning standards, hand washing, personal protective equipment, PPE, cleaning, counting trays, and countertop equipment. And the last one is composed of order entry and processing, 21.25% of the test. Procedures to compound non-sterile products, which is your ointments, mixtures, liquids, emulsions. Formulas, calculations, ratios, proportions, allegations and conversions, SIC codes, your BID, TID, and Roman numerals, abbreviations, medical terminology, and symbols for day supply, quantity, dose, concentration, and dilutions. Equipment, supplies required for drug administration, your package size, your unit dose, diabetic supplies, spacers, oral and injectable syringes. We'll go over lot numbers, expiration dates, and National Drug Code, your NDC numbers, which are for identifying the drug and pulling the correct drugs. Procedures for identifying and returning dispensable, non-dispensable, and expired medications and supplies. Each day we'll go over one of these. We're going to start with medications first. That's the majority of the test is 40%, almost half of it. But first, we're going to take a pre-test to see where we're at, and give you about 30 minutes to do it, and then we'll answer it, and then we'll go over certain questions that might confuse you. And like I said, we're going to do the majority of medications first. Thank you. And this is mainly just to prepare you what to expect on the test, because what they give you, what condensed curriculum gives you is, to me, is not what they'll go over certain things, but not completely what I think that you need to learn. So go ahead and start answering those. And I guess about 6:40, I will start answering those questions, and you can follow along as I answer them. And don't worry if you don't, I mean, just guess at it if you don't know it, if you don't understand the question. That lets me know what we need to really focus on.